Good morning, ladies and gentlemen. Welcome to lecture 4 of week 1 of this course on physical medicine and rehab in sports. Today, we'll be discussing overuse injuries in athletes. I'll be covering this presentation as per the following outline. Introduction to the topic. We'll speak about some common overuse injuries. We'll talk about the role of imaging in the diagnosis and management of common overuse injuries. We'll definitely be talking about the role of physical medicine and rehab in the management. We'll talk about biomechanics, and we'll talk about how nutrition is important in the prevention, in the treatment, and in the rehab of these injuries. We will discuss some return to play criteria, and we will conclude with a take home message. Overuse injuries are injuries caused by repetitive microtrauma without adequate recovery. Please note, ladies and gentlemen, if you are undertaking any training, there will be microtrauma in your body, in the bones, the tendons, the ligaments, and the muscles. If adequate time is given after the training session, these tissues will recover. If adequate time is not given and a further training load is applied before full recovery, then it becomes repetitive microtrauma, and then the injury will become an overuse injury. Overuse injuries accounts for a significant percentage of sports-related injuries and can lead to chronic conditions if not managed properly. The management strategies include load management, rehabilitation, prevention, and proper recovery protocols. These are some of the common overuse injuries which are seen in athletes. Tendinopathies such as Achilles tendinopathy, patellar tendinopathy, rotator cuff tendinopathy. Stress fractures of the tibia, metatarsals, femur, and the lumbar spine. Lumbar spine stress fractures are seen most commonly in cricket in fast bowlers. Muscle overuse symptoms such as shin splints, compartment syndrome, iliotibial band syndrome. Bursitis such as trochanteric, subacromial, and prepatellar bursitis. Cartilage damage may occur, leading to conditions such as chondromalacia patella and osteochondritis dissecans. The pathophysiology of these injuries are: it occurs due to a breakdown of tissue due to repetitive mechanical stress without adequate recovery. Chronic inflammation leads to tissue degeneration rather than healing. And the risk factors are training errors, biomechanical abnormalities, inadequate nutrition, and improper footwear. Let's talk about tendinopathies. Are defined as chronic tendon degeneration due to excessive repetitive loading. The common sites are Achilles tendon, patellar tendon, and rotator cuff, leading to runner's ankle, jumper's knee, and swimmer's or thrower's shoulder. The symptoms are pain, stiffness, swelling, decreased strength, and a pain which worsens with activity. Management techniques include activity modification for reducing repetitive stress and to avoid the aggravating activity. Exercise therapy involving progressive loading through mainly eccentric strengthening exercises. Modalities may be used as adjunct therapy such as shockwave, dry needling, and local ultrasound therapy. Medications such as non-steroidal anti-inflammatory drugs and local corticosteroid injections may be used for pain relief and reduction of inflammation. Stress fractures. Defined as small cracks in bone due to repetitive impact and insufficient recovery time. The common sites are tibia, metatarsals, femur, and lumbar spine. Symptoms are a gradual onset of localized pain, tenderness, and pain increasing with activity. Management of stress fractures involves immediate rest to avoid impact activities to allow for healing. A gradual return to load-bearing activities so that there is a progressive increase in the load. Nutritional assessment and treatment with calcium, vitamin D, and improvement of overall caloric intake. If there are structural abnormalities which are contributing to the excessive stress on the bones, use of orthotics are indicated. Shin splints. Medial tibial stress syndrome, commonly seen in runners or military recruits. Defined as a pain along the inner shin caused by repetitive strain on muscle and bone tissue. Risk factors: running on hard surfaces, improper footwear, excessive pronation, and training errors. Symptoms: diffuse pain along the shin, which worsens with exercise and subsides with rest. Management of shin splints include rest and ice for initial pain relief and reduction of inflammation. Strengthening exercises for gradual conditioning of the calf and shin muscles. Biomechanical corrections using orthotics, gait analysis, and correction of the foot mechanics. Gradual return to running using a controlled reintroduction of training loads. Compartment syndrome. If there is increased pressure in the muscle compartments during activity, causing pain and neurovascular compromise, it is called compartment syndrome. One of the most common subdivisions is chronic exertional compartment syndrome. It is commonly seen in runners and cyclists due to repetitive leg movements. And the symptoms are tightness, aching pain, numbness, weakness, and these symptoms subside with rest. The management of compartment syndrome is initially non-surgical with activity modification, stretching, and myofascial release techniques, including deep muscle and deep tendon myofascial release. If the symptoms persist or if the compartment syndrome becomes severe, then fasciotomy is prescribed. Bursitis. Inflammation of bursa due to repetitive friction or compression. Common sites are shoulder, knee, and hip. The symptoms are localized swelling, tenderness, and reduced range of motion. Treatment is initially with rest and ice to reduce the inflammation. Anti-inflammatory medications such as NSAIDs and local infiltration of steroids for pain relief. Stretching and strengthening exercises for reducing mechanical stress on the affected area, and local infiltration of corticosteroids or PRP or stem cells may be used. Chondromalacia patella. softening and breakdown of patellar cartilage due to repetitive stress. It's commonly seen in young athletes, particularly runners and cyclists. The symptoms are anterior knee pain, crepitus, pain which worsens with prolonged sitting or squatting. Management includes quadriceps strengthening, emphasizing on vastus medialis obliquus muscle. Patellar draping or bracing may be required to improve patellar tracking. And aggravating activity such as deep squats and repetitive knee flexion should be avoided to avoid aggravating the injury. There is a definitive role of imaging in overuse injuries. X-rays may be used for detecting stress fractures. MRI is used for detecting soft tissue and bone marrow edema. And MRI is usually ideal for picking up these overuse injuries at a very early stage. Musculoskeletal ultrasound can be used for real-time tendon assessment. The advantage of musculoskeletal ultrasound is that it allows for dynamic assessments. And in doubtful cases, you may use bone scan. Role of physical medicine and rehab in overuse injuries. The PMR specialists use modalities for reduction of pain, inflammation, and to promote healing. They use manual therapy for pain relief and for restoration of mobility. Neuromuscular retraining is used to improve movement patterns. Progressive loading programs, which are tailored to the individual, are prescribed and adhered to during the rehab for overuse injuries. Drug therapy may be prescribed and used in specific instances during the treatment and rehab of overuse injuries. There is a big role of biomechanics in biomechanical assessment and correction. You use biomechanics for correction and analysis of gait and running to identify improper movement patterns. If you find foot abnormalities which are causing these excessive stress injuries, you may prescribe orthotics for treatment. If there is a postural abnormality found during analysis, you may prescribe postural correction techniques to reduce unnecessary strain on a particular region of the body. For nutrition and recovery strategies, you should prescribe adequate protein intake, which will help in tissue repair and recovery. Calcium, vitamin D, B12, magnesium, and zinc are essential in maintaining bone health and should be prescribed. The role of hydration and electrolyte balance is vital in injury prevention and during the rehab process. Return to play criteria. Pain-free functional movement with full range of motion. Strength and conditioning testing to ensure readiness and psychological readiness for competition. We'll talk about a case study. A runner with Achilles tendinopathy presented with gradual onset of Achilles pain in a long distance runner. The treatment plan included load management, biomechanical correction, and eccentric muscle strengthening. And the outcome was a successful return to training with modified load progression. Case study 2 involves a basketball player with stress fracture of the lower limb. Presented with gradual onset of foot pain with increased training loads. The treatment plan included activity modification, bone strengthening nutrition, and progressive rehabilitation. The outcome was a full recovery with adjusted training program. Prevention strategies. We have to prescribe age appropriate training program for these individuals. We have to ensure that the training program is designed and implemented properly. Ensure that there is a gradual progression in training loads to avoid overuse injuries. Make sure the individuals are indulging in cross training to reduce repetitive stress on specific tissues. Make sure that the individual is indulging in regular mobility and strength work to ensure resilience. The future trends in overuse injury management has advances in regenerative medicine in the form of PRP and stem cells for tendon healing. Using wearable technology for monitoring training loads and injury risk is coming up in a big way, and artificial intelligence driven rehabilitation programs for personalized treatment has to be ensured. Take home message: overuse injuries are caused by repetitive micro trauma without adequate recovery. The common injuries are tendinopathies, stress fractures, shin splints, bursitis, and cartilage damage. Chronic mechanical stress leads to tissue breakdown and inflammation. Usually managed with activity modification, exercise therapy, adjunct treatments, and nutrition and recovery strategies. Prevented by gradual training progression, cross training, and biomechanical corrections. The future trends are use of regenerative medicine, wearable tech, and AI driven rehab for prevention of overuse injuries. These are our references, ladies and gentlemen. I strongly urge you to go through them because there will be an assignment at the end of every week, and there will be a course ending exam if you want to qualify for a certificate. Thank you for enrolling for this course, and thank you for your patient listening, ladies and gentlemen. Jai Hind.